Alright, so I'm making my way. Alright, come on, making my way to St. Thomas's Hospital to do a talk about sickle cell and pregnancy, and then also to talk about my foundation. So the organizers contacted me and asked me to participate, because I'm already part of a research project they're doing to find effective ways to manage pregnancy of sickle cell women, women with sickle cell. And my own experience was bittersweet, but I think the good thing is that instead of just kind of keeping it to myself and getting upset, whatever the case may be, it's best that that experience I used it to make sure now that people are more trained to be able to deal with such situations, like people like myself. Even midwives need to be kind of aware of us and the way we are affected and the way our health gets worse during pregnancy, because I had some very extremely ignorant midwives that were saying all sort of inappropriate things to somebody that's already going through a lot. I'm here fighting for my life and the life of my kids. My first time, my first pregnancy, I don't have experience in this, and I'm relying on them to kind of give me that support and guidance, and just to make sure that I'm on track. And instead those same people just use that as a way to undermine me and literally just say things that they know nothing about regarding all the medications I was on. I was on painkillers, strong painkillers that I've always been on for my condition, and during pregnancy my condition got worse. And I already was a high-risk patient because I have sickle cell, and then secondly I was carrying twins, so I was double, triple high, so high-risk patient. So it was very difficult to kind of try and find what works in order to save the lives of myself and my babies as well at the time. And of course I was going through pain and all that. It's bad enough when it's just me, and I was struggling already with my condition I always have, and then now carrying two lives, which just pushed my body to its limit, and I was going through a lot. And even because of what midwives were saying about this medication you're on, they're going to just, this will kill your baby, this, you end up having babies that are disabled, that this and that, why do you need this, without them even asking or knowing what the situation is. Number one, the doctors are the one that prescribe medication. Nobody, I don't go and put a gun on their head to do something. They assess individuals and they put a treatment plan. We had a plan on how we're going to work things out, but this midwives, they didn't understand that, so they were just seeing it as I'm gonna have kids, I'll be born addicted to this. So as a result I actually stopped. Like, I'll be in hospital in pain and I'll be really afraid to ask for pain relief because of what they were saying. And one time I had said mentioned that to my gynecologist, who told me that, Miriam, if you are not okay, you are now our priority. Yes, the kids are, but you are more of a priority, because if you are not okay, how are you going to deliver them in the first place? How are you going to bring them into this world? So if we cannot make you comfortable, if we cannot treat and keep your pain under control, how is that going to work out? But these midwives did not care, and it was just difficult. I was even told by a midwife that I was selfish for bringing lives into the world knowing my condition. And I was like, are you kidding me? Like, seriously? Kidding me? I was so upset that day. My husband left work to run to the hospital, but they ended up, I don't know what happened, but they ended up putting another midwife in charge of me to care for me instead of that one, because it was just too much. And they said, oh, she apologizes, she this and that. It's like, why are you coming and saying things you know nothing about? You know, it's things like that that just bug me. Don't come saying things for something you know nothing about. Try and talk to me if you want. I am always an open book to help and educate people more. I'm always an open book. If somebody's got questions, you know, regardless of how much pain I'm in, there are some times when I'm in a lot of pain I can barely talk, but as soon as the pain is just, you know, a bit bearable, I'm always more than happy to discuss things. And if somebody's not sure, if they ask, or we can, you know, we can share information, help each other out. I can learn more, they can learn more as well. So that's why I'm really glad, and I am honored to be part of, you know, a project that is trying to make things better. So my experiences that I went through, others will not go through the same thing as well, you know. So that's why I say sometimes you have to use your experiences as a way to help the world become a better place than the way it was, instead of just sitting down and feeling sorry for yourself. It's like, how can I use that, how can I make this better? And that's why they, you know, invited me to join this project, this research project, and now as well to do this talk to literally a whole, Lord knows, I think they said about 100 people, so full of medical professionals, and for them to be able to hear it from the actual people they're treating, and for them to be able to ask questions or have the opportunity to talk to me when I'm not in pain or on medication and can barely keep my words straight. So I think it's a really good thing, and that's why I'm always up for supporting these things. And they want me to talk about the foundation as well and the work that we do, which I'll be more than happy to talk about, because it was after I had already started the foundation before my godparent, but it was after I had my kids that I was really motivated to keep pushing, because as like this experience that I went through, I don't want others going through that. So it made me push even more to be able to make sure that these things change. But in terms of support, my team and the gynae team, they were able to work together really well. That I can't even complain. They were able to work together. It was just, you know, few ignorant people, but overall I really received good care, and everybody did their best. And now, you know, to be able to be here, say the story, and the kids are here as well, they're healthy. That alone is a blessing and a miracle in its own. So I just have to keep pushing and making sure that, you know, our voices that can represent those that maybe don't have the platform to come out and talk these things, I can be a representative for them. These patients that don't have the opportunity to be in things like this or to be involved, I have to represent them well.
We often leave the best to last. Clearly, our aim is to ensure that, to understand the story from the mother's perspective, and we are privileged enough to have Miriam here, who delivered with us, delivered twins, and will tell us a bit about her story. She is doing fantastic work with regards to her foundation as well, and hopefully we'll hear a bit about that as well. So thank you, Miriam.
Thank you very much. You can hear me from the back. Thank you, Dr. Eugene. As Dr. Eugene said, my name is Miriam, and I am a sickle cell patient for SS, and I've always been treated in St. Thomas's and Guideline with my team from the sickle cell team. But growing up, especially as a teenager, I had a lot of issues regarding my pain and you know, complications with sickle cell from puberty. And then down the line as well, I was also diagnosed with endometriosis. So that was another, you know, just blow. So when I was once I finished university, I always knew I wanted kids, but thinking about my condition, not only sickle cell, but also having endometriosis, I obviously spoke to the gynecology specialist that I was seeing and the team, and I was always just worried that this might be an issue, because in regards to, they try to treat my endometriosis different ways. They tried tablet, we tried pills, we tried injection, depot injection, and everything you can think of. And at one point they had to be injecting me with Zolidex to basically freeze the reproductive system, just because my menstrual cycles were causing me so much pain and triggering my sickle crisis. So of course with that injection comes the risk of when you actually now want to have babies, that might be an issue. So when I met my husband, and of course the first thing, before even the first date, I made it very clear, I've got sickle cell, and if you want to be with me, you have to get a test. And obviously, he is very afraid of needles. So when he got the blood test done, after literally almost having a heart attack, fainting, and got the test done, I knew, okay, I think he loves me. For him to do this, he must, because he hates needles. So once we were sure that we wanted something serious, we were working towards getting married. So I was on hydroxyurea for many, many years. I spoke to my team, and this was 2015, around the summertime. I spoke to my team, the sickle cell team. I was like, I am in a serious relationship, we're planning on getting married. And obviously, I would love to have a child. And of course, the team were very supportive. And we had an entire plan set out. I was traveling in September of that year. So the plan was, when I come back, I'm gonna go and they're gonna stop the hydroxyurea, because I needed to be off it 6 months before I can, start trying for a baby. And also for me to go and see a reproductive specialist just to do any checks. So that was the plan. But as we all know in life, things don't always go as planned. And as soon as I came back from my holiday, I went in September, I came back beginning of October. As soon as I came back from my holiday, I was of course thinking to myself that it's fine, I'm on hydroxyurea, I'm not gonna get pregnant. So at that time I was on the pills to help to control my endometriosis, but I was taking, sometimes I'll come into hospital to get admitted, they would not have it straight away to give it to me, so it wasn't like I wasn't like having it every day, but I thought nothing's gonna happen, it's fine. And then to my surprise, it doesn't work that way. Because even though I was still on hydroxyurea, I had not even seen my team, nor have I seen the reproductive specialist, nor have we stopped the hydroxyurea. So when I found out I was pregnant, I obviously thought it was a joke. This test was the real faulty. So I did 3 more, and it was still positive. And I thought to myself, okay, something is not right here. And I told my husband, who was very happy, I'm like, don't be too happy. It might be that the tests are faulty, false alarm. Let me go and see the GP. The GP confirmed that I was still like, no, I think they should do a blood test. And the GP is like, at this point, we don't think you need a blood test. I was like, okay, so this is it. This is happening. We are gonna have a child. So of course, when I told my team, they were happy, and we had to stop hydroxyurea immediately because we had not even gotten to the point yet. And I remember Dr. Rachel saying, Miriam, we had a plan. I'm like, I know, and God had another plan. So here we are. So, but we went on straight to just stop hydroxyurea and to put a plan in place. So the plan was I would go on to the exchange. which I was back on while I was at university. So we went back on to getting the blood exchange, and things were okay, but then I was having just constant stomach pain and crisis back to back, and I would just be having crazy symptoms. I would have sickness, the same morning sickness, but mine was morning, day, night, midnight. I was just getting sickness. I was like, I thought they used to say morning sickness. Why am I getting it like 4 in the afternoon? And my mom is like, it's just a term. It doesn't mean it's only going to happen in the morning. So one time I'd been admitted with the same, just really, really bad stomach pain. So my doctor's like, okay, we'll go and get a scan to check that the baby is okay. Because what happened when I when I was having the stomach pain, I was at A&E. They did a test, and because I told them I'm pregnant, so they did a test to also check my urine to make sure there was no infection. But then, in terms of pregnancy, it came back inconclusive. I was like, I come back and I told you, I think it's a false alarm. Now look, it's inconclusive. And the doctor's like, no, sometimes it can be that it doesn't mean. So I was just like, oh my God, please, we can't come this close and not really, it not happening. So I was distressed the rest of that night. In the morning, they arranged for me to have an ultrasound by guys. So they came, they picked me up, took me to where we went to do the ultrasound, and when it was my turn, I went in. But because at this time I was only about 6-7 weeks, they had to do an internal test, an internal ultrasound. And I stood there, the sonographer had a screen like this, and she was just pressing, and the way she was doing her face, and I'm there with my legs open, like, what is happening? Why is taking so long? And I just want to know that the baby is okay. I was like, is the baby okay? Is the baby okay? And she turned the screen to me. She's like, they are fine. I was like, so when she turned, she showed me this too. I thought maybe it was my 2 ovaries. Because they literally like little jelly bean, and I was like, what do you mean they? It's like, oh, you didn't know. You're having twins. And I stood there, it was so uncomfortable. She had the screen. I was still there, still couldn't move my legs over, and she's like, okay, I'll give you a couple of minutes. She came back, I was still like that. She's like, well, darling, you can get dressed. And I was still trying to process everything. I was like, a part of me was like, oh my Lord, my life is over. All I think of is two. How am I going to take care of 2 when I myself have my own issues? I need care. I need somebody to care. How can I go and care for 2? And I was like, it's okay. You have to, kind of get dressed. I have another patient. Okay then. And as I waited for the porter, I called my mom. And I don't even know, all I kept saying is that, Mom, it's 2. It's 2. Well, it's like, what do you mean? Are you okay? It's 2. I'm like, Mom, it's 2 of them. Like, who is 2 of them? Like, I'm okay. Oh, my life is over. And she was there dancing. I was like, okay, I need to understand me right now. I called my sister, same thing. I was like, okay, these people clearly, they're not even thinking. All I'm thinking is that 2. And then they said they were non-identical, which means there's a possibility it would be 2 boys. And I had helped to raise my sister's son. He was 4 in 1. If I have 2 boys, I'm like, oh Lord, I'm done. I told my husband to come and meet me. I called him, I was like, when you finish, just come please, bring me some food. He came, I was in a room by myself, I was in the side room. He sat on the chair, which was next to the door. I was like, at least, if I tell him now, he at least can just open the door and run. If he realizes that, no, I'm sorry, I can't do this. And I told him, he got up, I was like, that's it, he's going. And then he came over and he hugged me, he's like, are you kidding me? We prayed for one, I prayed for one, and now we're having two. I'm like, why is everybody not understanding that these two separate human beings with two different characters? Why isn't anybody understanding this? And that's what I was thinking, like, how am I even going to survive this pregnancy? Of course, deep inside, I was also happy because to go from that to this was a great miracle, of course. And so I was like, okay, this is happening. I just have to pray now, number one, that they're going to just take it easy on me when they're here. And number two, that I get through this pregnancy and smoothly. And the team got together, the team and the sickle team and the gynae team, they worked so well together. We had a plan put in place and everything, like they literally planned every week and anticipated anything that can go wrong. If this happened, and they were so well prepared. And Dr. Eugene was always there. There would be times I would just be fine, I would be in pain. And we had a plan that we were going to slowly decrease the medication. But the problem that I had, the gynecologist, the team, the doctors, everybody understood, like, okay, sickle cell pregnancy. But when you went to that point, I think after 16 weeks, I had to be at St. Thomas's because that's where the birth center is. So there were times I'll be admitted at the birth center. And you know, most of the time I had very good midwives that cared for me. The doctors, I had no complaint. But unfortunately, with every good thing comes some things that are not so good. And but then I don't see as bad. I feel like some people are just not well informed. So there are times when I'll be admitted, and of course the doctors have a plan, and I'm going with the plan. That's all I'm doing. I'm not writing it. I'm not telling them this is what's going to happen. They have spoken to me and we've got a plan in place. But then when midwives will come and they hand over to them, all they're seeing is that, okay, 20-something-year-old, pregnant with twins, and okay, she's having morphine, and some of them straight up are like, why are you on all this medication? Do you know this is only going to kill your babies? And I used to just be like, this is the plan. I'm not a doctor. I did not write this. I'm only going with the doctor's plans. And it went so far as I was so afraid, besides people saying, oh, some, and this is very few. Most of them were very, very understanding. And I feel like it's because maybe some of them, I just feel like maybe they're not well informed because they're used to dealing with just pregnant women. Not pregnant women with sickle cell, because our own care is very different. So I tried my best to understand that. But then I will constantly also get some people that are saying, midwives that will be telling me, you know, this, you're going to end up having, you know, your babies are going to be born and you're going to be addicted to all these medications. So that worried me so much. I'm a first-time mom. I'm just learning as I go on. And so hearing these things as a mom, of course, I'm like, I need to protect my babies. I need to. And there will be times when, even though I'm in a lot of pain, I'm not requesting for pain relief because of my fear of hurting my own kids, or, you know, when I was so paranoid to the point of watching videos, you know, of neonatal babies in neonatal that have been born addicted to these things, and literally I'll be crying, and because of that, even when I'll be in pain, I'll be so afraid to ask. And I remember one day Dr. Eugene came to see me, and he's like, oh, Miriam, why are you not, you know, it looks like you're in a lot of pain now, why haven't you requested for your medication? I'm like, because I'm just afraid, and that I don't want to end up having the kids, and it will be my fault if they come and they having any issues, they're addicted to this. And Dr. Eugene is like, Miriam, we have a plan, and I want you to remember that without you, there will be no them. You need to be well to bring these babies into the world. So our priority, yes, the baby is our priority, but it's also you, because we need you to deliver them. So of course, I just trusted the team, and everything was just put in place and it was working well. I had, few complications here and there, but for me, it was more so the way the pregnancy impacted my sickle crisis. I was in almost every other week. It went to the point my husband's like, why don't they just keep you there? There's no point, you're coming home 2 days and you're back. Let them just keep you there. After, you can come home. And it went to a point as well, like at home even when I was in so much pain. And because as well, to help with circulation, I needed to be injecting myself with the clepsine injection. And it was literally like, okay, dinner's ready, injection. It became something so normal. I'm sure anybody had walked into our house would have been like, what do these people do? Because they'll be seeing somebody just injecting themselves like it's nothing. But I needed to do what I needed to do to make sure that I'm following the guidance of the team, because they're professionals at it, they know. And we're all learning along the way as well, because obviously there were some things that I was going through, maybe they had not seen. So that was the good thing. And it just, after some time, obviously the crisis was just back to back to back, to the point I was physically, emotionally, everything drained. My husband felt so bad for me once we knew we needed to do what we needed to do to make sure that I get through this. And luckily for me, besides the medical support, I had a very supportive family as well that kept me going, because I'll be in back to back. I'll just be so frustrated and just like drained. Even though I ended up having my twins at 33 weeks, it felt like I was pregnant for 33 months because it was just so draining. And I was just like, oh my Lord. But at the end of the day, the fact that I would get 2 lives from this, for me, is like, I will do that over and over, even today. If I have to go back and go through all of that to get them, that would be no problem. So coming near, I had gone, we had a plan as well, after I was having some issues and that. So Dr. Eugene, we had even a date that, okay, we're going to they're going to deliver the babies at 37 weeks. But as I tell you, it's like my kids make up their own plans. They will always do what they want to do. They came when they're not even expected, and now they're like, we're going to come to this world too, not on your time, but our time. So at 33 weeks, I came in thinking it was just normal. Oh, at first, I was at home, and luckily I just had my baby shower and got my gift. So it was just the weekend after my baby shower, like, oh, thank God. Otherwise, I would have had to miss on all those gifts and pampering. So just after that, and I remember that weekend, I was just constantly weak. I literally, usually when I do have a crisis, my eyes will get a bit yellowy. But this time, they were bright yellow. And my mom is a nurse. So I called my mom that night. I'm like, Mom, I don't feel good. And my eyes, I know they get yellow, but this is like really yellow. So my mom's like, send me a picture. I took a picture, I sent to my mom. My mom is like, go to the hospital. Went into the hospital. By this time, anytime I drink anything, as soon as I drink, I have to run straight to the toilet. But I didn't understand any of this. I had not even heard the word preeclampsia until I realized I had it, until I was told I had it. So after being rushed into the hospital, and then they did some tests, and I remember Dr. Eugene coming to the ward, and luckily for me, my sister happened to just be there. She came to see me, and Dr. Eugene came and asked, how soon can your husband get here? I was like, why? Like, because we're going to deliver the babies. I was like, no, they're not ready. They're not ready yet. It's 33 weeks. We have to give them some more time. And Dr. Eugene was like, no, you have preeclampsia. And they explained to me, because I think I'd had the word one time, but the article that I'd read about it, I think he had said is more so like older women. So I was like, I'm 25, what am I going to do? So it's not something I even ever took serious, read about or anything. And I don't think as well they considered me at the time as high risk for that. So I was not prepared, I didn't know much. So Dr. Eugene and other doctors were kind enough to explain to me what it was and why the baby needed to be delivered. And my husband, I called, and my sister called him, he was rushing. It was literally as soon as they about to pull my bed towards the theater, I walked in. So it was no talking, like, put on your robe, we are going straight to the theater. And he was so worried at that time. This is the first time, both of us, this is our first time, having kids. And I remember he always tells me this because I was already in. And he said, as he was standing there so worried, and Dr. H is like, don't worry, the wife will be okay. In about 20 or so minutes, the cesarean will be done. And I was awake, luckily, and it was being rushed. So I was already in a lot of pain, but at this point I was like, we're here now, we just have to push through. And I will never forget that day when I had that cry. I could feel the push and tugging and everything. Couldn't say anything, but I remember hearing the cry, and he literally just made myself like, oh my God. And then a minute after, my son came first, and even though they say ladies first, he seems not to understand that. So he came first, and then my daughter followed a minute later. And they're still fighting over that minute. And I think that's something they're always going to fight about. So, yeah, so they were born, and because of my situation, I didn't get to hold my kids or anything. I literally had a glance of them as they were being taken to a neonatal, because especially my son was not as developed as my daughter, so they needed to be cared for. So they were taken to recover. And I was of course on magnesium treatment. And as long as I'm alright, that's what's important. And for the first 3-4 days, I was not able to go and see them. I'm heading home from the talk, the lecture, study day, whatever I call it. Yeah, unfortunately, my camera had stopped halfway through. This camera, this technology, these days electronics just do their own thing, so the camera had stopped. But anyways, it did record for, let me say, more than half of it anyway. And yeah, I was able to get the important bits and information, and in the end, there was a lot of people approached me and just saying how touched they were by my story, my experience. And for me, it's about all of us learning something, and as long as they're able to take something away from it, to basically don't just see us as a patient, but as a human, a mother, somebody that is also just like you, that has got feelings, and for them to know as well the weight of your words, and how lack of information can really affect. You can give your best care, but if you are not well informed, then you make certain remarks, you don't know how that is going to affect that patient. So hopefully, but it was medical professionals from different hospitals, not just St. Thomas's, my hospitals, from different hospitals. So as long as they're able to, they as well will go and also pass on that information. And you have to start somewhere, and then in the end as well, the organizers, some of, yeah, because they asked me to talk briefly about the foundation and give our information, and some people are actually, they're interested in donating and see how they can help. And then the organizers of the event as well, the program, they are also going, they want to make a donation to the foundation. So I say something positive to come out of all that experience and everything. It was really good. When I went there, they were still talking anyway, and I was able to at least I myself learned some things from some of the presentations that were going on. So yeah, it was good, and I'm very grateful, and just to keep pushing. But making my way home now, I'm tired. I'm gonna go home and rest, hopefully, finger crossed, if those two let me rest. But either way, I love them, so I'm looking forward to it. If you see, I don't know if you noticed my outfit. Can you see that little shape? You know what that represents? Yep, the sickled cells. I know, right? So I came representing. Some people noticed. So yeah, because that's how our cells are shaped. And then when there's not enough oxygen or fluids, they stick together, and when they stick together, that's what causes crisis. So yeah, I didn't intentionally bought it for that, but it was after I bought it and I saw it, like, oh, so I just thought it would be perfect for this occasion to go with my shoes as well. To go with my shoes. So I'll put a picture of my whole outfit somewhere. But anyways, I'm gonna head home, eat something, and probably try to rest. I don't know if that's gonna happen, but yeah. So bye.